Okay, today I'm going to talk about a topic that most people normally don't want to talk about, and that is sexually transmitted diseases. And in particular, we're going to talk about gonorrhea and chlamydia. I know it's embarrassing, you guys, but sometimes if you do think you've gotten infected, if you do think you are at risk for having something like this, then do yourself a favor, get the peace of mind, and get tested. So let's take a look at these two. Okay, like I said, we're going to go over gonorrhea and chlamydia. We're going to go over gonorrhea first. With gonorrhea, there's a couple different nicknames for it. It can be called the clap, the drip, dose, strain, gleat, or a lot of people call it the whites. It has an incubation period of around 1 to 14 days, and it's caused by a bacteria. And that bacteria can cause infections in men, women, and even new babies. So if the mother has it, then it can actually be present in the new baby. So it's very easy to pass along with sexual partners and babies during childbirth. So symptoms in men. Normally, they'll get a discharge from the penis. It can be thick or it can be milky white, yellowish. Sometimes it can be greenish, and a lot of times men will complain that there is burning while they urinate. Some of the complications in men, if it's not treated, you can get swollen or tender testicles, and you can actually your testicles will swell up almost to the size of a grapefruit, and you can get an infection as well. I'm not even going to attempt to pronounce that there. And women, usually they're asymptomatic. They may have painful urination. They may have abnormal bleeding or painful sex. And they can actually get something what's called Bartholin's abscess or pelvic inflammatory disease, both of which are not good to have and can be rather painful. So, like I mentioned earlier, a mom can pass gonorrhea along to her child during childbirth. So, gonorrhea is very easily tested for and treated. They do a test, or they'll do a urine test or a swab, and it can be easily cured with antibiotics. But any damage that has occurred to the body cannot be repaired. So it's important that if you think you do have an STD like that, then to go out and get checked so that you can, get it taken care of before any permanent damage occurs. Now with chlamydia, it can cause infection the same way. Men, women, newborn babies. It's also caused by a bacteria. The incubation period is a little bit longer. It's 2 to 3 weeks, and people can pass it, to each other through sex, and also a baby can get it during childbirth. Symptoms for women, normally they might have a little bit of a abnormal vaginal discharge, and they can have pain during sex. With men, with women, they can also have the same pelvic inflammatory disease, which is basically where, if I understand it correctly, one of the fallopian tubes gets swollen or gets enlarged. With men, usually they don't have symptoms. They can sometimes if they do, they're going to have discharge from the penis. Again, it can be a little bit runnier. It's not as thick, and it can be whitish. And of course, there's burning on urination is another common complete or another common complaint. And complications, if not treated, could be swollen and tender testicles. So, very, very similar symptoms for both of them. And testing and treatment with chlamydia, urine test or a swab, you can find it the same way. They're going to give you antibiotics if you have them. And again, any damage to the body cannot be repaired. So, you guys, if you think you have an STD, get it checked. Okay? Call this number, 877-236-1460. It's a private, discreet way to get tested. This company they have locations in every single major city in the United States. They normally have 3 or 4 locations. And the best part about it is a lot of people get embarrassed to get tested. And a lot of people are scared to get the results, actually. But once you get the results back, it can be tested, and you can be tested for it, and you can be cured for it. You don't want to do permanent damage to your body. Now, if you're embarrassed about getting a test like this, when you call this number, they'll give you a location that's close to you. What's cool about it is they don't just do STD tests there. So if you're going in and out of the facility, nobody knows whether you're going in to get tested for diabetes or the flu or whatever it is. They run hundreds of tests out of these locations. So if you feel like you're going to be embarrassed because you're going into a place to get tested, nobody knows why you're going there. So call the number. If you feel like you might have been exposed, if you're having urination, if it's burning during urination, if you're a guy, or if you have any kind of discharge, definitely want to get it checked out. If you're a woman, you have excess bleeding or painful intercourse, please get yourself checked, do the right thing, be responsible, and call the number.